Good afternoon, Hayden Maxwell. Let's begin the warm-up session. Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There's also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills, and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. It's completely normal to feel a bit overwhelmed, especially after your first session. My name is Hayden Maxwell, and I'm one of the nurses here. I'm just going to go over some important information about how you're feeling now and what to expect with your fistula care moving forward. So, tell me, how are you feeling right now?
Well, I'm a bit tired, and my arm feels a little strange where they put the needles in. It's just a lot to process.
It's good that you're paying attention to how your arm feels. Now, Mihiraa, about that area, it's really important to know what to do if you notice any bleeding from the AV fistula site. If you see any blood, the first thing to do is to apply direct pressure firmly over the area. Then, you should elevate your arm above your heart. If the bleeding doesn't stop within about 10 to 15 minutes of doing this, it's crucial that you seek medical help immediately.
So just press on it and lift my arm? Okay, I think I can remember that. What about this bandage?
Good question. This is a pressure bandage, and it's there for a reason. You'll need to keep this bandage on for at least 6 hours to help prevent any further bleeding and reduce swelling. Its main purpose is to apply gentle, continuous pressure to the site to aid in clotting and healing. Make sure it stays in place for the recommended time. Do you have any questions or concerns?
I got it. I'm a bit worried about moving my arm too much. Can I still do normal things?
That's a very sensible concern, and it's important to be mindful of your fistula arm. To protect your fistula and ensure it lasts for a long time, there are a few important things to keep in mind. Mihiraa, you should definitely avoid heavy lifting with that arm. Think of your new fistula like a delicate pathway that needs time to strengthen and heal. Putting too much strain on it with heavy objects could damage it. Also, try to avoid wearing tight clothing on your fistula arm. Anything that constricts the arm can put pressure on the fistula, which we want to avoid. And it's really crucial that no blood pressure readings are ever taken on your fistula arm. The pressure from a blood pressure cuff can be too much for the delicate vessels in your fistula. By being mindful of these activities, we can help ensure your fistula remains healthy and functional for your future dialysis treatments.
That makes sense. I definitely want it to work properly. What else do I need to do for it?
Beyond protecting it from strain, daily fistula care and hygiene are incredibly important. Mihiraa, you should keep the area clean by washing it gently with soap and water daily. Also, it's vital that you inspect it daily for any changes. What you're looking for are signs of complications, such as swelling, redness, pain, numbness, or a feeling of coolness in the arm. If you notice any of these signs or anything else that seems unusual, you need to report them to your doctor or nurse as soon as possible. Early detection can make a big difference.
Okay, I'll keep an eye out. Is there anything I can do to help it get stronger?
That's a fantastic question, Mihiraa, and it shows you're really engaged in your care. While we want you to avoid straining your arm, there's actually a very beneficial activity that we encourage, using an exercise ball. We're talking about a small, soft ball, like a stress ball, that you can hold in your hand. The purpose of this exercise is to help your fistula get stronger and more ready for your future dialysis treatments. When you gently squeeze and release the ball with your fist, it helps to strengthen the vein itself. This repeated squeezing action also helps to increase blood flow through your fistula. Think of it like a muscle getting stronger with exercise. The same applies to your vein. By consistently doing this exercise, you're helping your fistula to mature, meaning it will get larger and stronger, making it easier and more effective for the dialysis team to access it for your treatments. Do you have any other questions or concerns that have come up for you today?
Sure, I can do that. I guess I'm just wondering what the future holds for these sessions.
That's a great question, Mihiraa. For future dialysis sessions, you can expect to come in about 3 times a week, and each session will typically last approximately 4 hours. To make yourself as comfortable as possible during these sessions, it's a good idea to bring a blanket or anything that helps you feel cozy. Most importantly, try to stay relaxed during the treatment. We're here to help make this process as smooth as possible for you. Do you have any other thoughts or questions about what to expect?
No, you have explained everything perfectly. Thank you.
My pleasure. Take care, Mihiraa.